Hi you guys, I'm here with my IQAir dental series machine. This is clearly the best machine on the market. The machine is actually on. You can barely hear it. So if you guys want something that's going to protect you, the staff, and the office, I highly recommend the Dental IQAir series. There's no other competition. This is the best machine on the market. I had my machine over a year, flawless. This thing is a tank. I think it's indestructible, my personal opinion. So first I'm going to show you how to install the LT onto the dental tube. So once again, you want to warm the plastic up. And I like always doing this sitting down. It gives me better control over it. So I put my hand on the inside over here and slowly bend this. As I'm bending it, I take my time. And then as I get in it, I'll put it in a hole right here. And after it's in the hole, then I close it down. I already have put the zip tie in there. So this is the best way. You want to thread the zip tie to the two openings right above the AirGuard logo, and then I already close the zip tie up just a little bit. It makes it easier. It's like a lasso basically. So then all you have to do is just slide it on. Very simple. I like to use two hands and slide it on easy, and then you'll hear it click sometimes, like you just heard. And then once you do that, then you want to bring this down, like so. And voila, you have it on. And all you got to do now is close down the zip tie to lock it. So now you have it locked on with the zip tie, and then the clamps have clamped on to the rivet of the dental tube. This has now changed your Dental IQ machine into an aerosol and fluid barrier. This will block all fluids coming out the mouth. It will capture all fluids out the mouth. Once it hit the shield, it would then be sucked in by the IQ dental tube. And then when it comes out of the machine, it's clean. So therefore, keeping the atmosphere of the dental office safe for the patients, safe for the staff and other dental members, the hygienists, also safe for other patients. Hygienists love this because most of the time they're in the room by themselves. They don't have an assistant to assist in suction. This can allow you to work by yourself with no other assistance. This captures all the fluids, all the aerosols. So a hygienist doing ultrasonic scaling don't have to worry about any fluids coming back and hitting them on the face or on the cheek or on the forehead. It also goes to other professions such as dermatology. They use a lot of tools in the face area, and they have a lot of fluids splashing everywhere. This can be a guard also. Also, we have some patients here that work for the coroner's office, and sometimes they have to do autopsies on human cadavers, especially when they use a bone saw. The saw goes everywhere, the shavings goes everywhere. So this can be also as a barrier for doing cadaver dissections of human bodies. This can also be that barrier that help protect the clinician in doing autopsies. So if you guys have any questions about the AirGuard or about the Dental IQ series, please reach out. This is the best unit with the best products. Thanks for tuning in to the station.